Welcome to everyone here, and we are very glad that you joined a special edition of our weekly webinar. We're going to discuss a topic which is very important and very close to our hearts. Today, we are going to talk about building a future-ready nursing workforce, Vision 2047. And this is not something where I'm going to be talking alone. I'm in conversation with Dr. Nitya Kalani, who's the CEO of Skillsformed. And I forgot to introduce myself. I am the founder of Skillsformed. And let's move to the next slide. What is this vision we are talking about? So 2047 is celebrating 100 years of independence. And we have just finished celebrating the 78th year of independence yesterday. And we thought it is the right occasion to look forward. And we're not actually looking forward 2 years or 5 years ahead. We are actually looking forward to more than 23 years ahead to our 100th year of independence, which is 2047. Because I feel the topic which we're going to talk about requires a lot of work. And unless we have a clear vision where we are going, we meaning all the healthcare leaders and all those who have any influence, either in a hospital or at a national level, should start thinking about this. I've reached out to several nursing leaders, and we are in the process of formulating a questionnaire which will be circulating with all the healthcare leaders, which also includes nursing leaders, and trying to get their opinion about how we should go about this. So this is just a start, a beginning, and this webinar, which is being attended by a small group of people, will be the sort of having the preview to the whole thing. So we are committed to this, and I want to do this as long as I have the energy to do so. Next slide, please. So I want to ask Dr. Nitya, who is the CEO and who has actually the practical experience of going to various hospitals and training. Being a founder, I do a lot of strategizing, and also I do a little bit of training, but it is more like a visiting, sort of professor training. But Nitya is hands-on, and she goes to each and every training and meets the nurses, uh, finds what barriers and challenges and tries to overcome. So she's got the sort of front line or on the ground feel of what is going to happen. And recently, she was invited to give a talk about future readiness, and she took up this topic because that I know that is something very close to her heart, and she's got very strong opinions about how nurses are treated currently and how this should change. So it'll be very interesting to listen to her, and I would sort of first ask her what are her thoughts about this topic, and then as we go along, I'll be asking a few questions and she'll be answering. So Nitya, can you sort of take up and tell what you think about this topic?
Good afternoon, everybody. I thank you all for joining us. As Dr. Pari said, though it's a small group, I think you're all a part of the journey which we're going to discuss now. So I'm so glad that you all had time to spend with us today. So thank you so much for joining. I thank Dr. Pari for giving this warm introduction. And we are going to talk about Vision 2047 for nursing in India. What are we going to do for the nurses? What is the vision for the nurses 23 years down the line? So this topic is indeed very close to my heart, as Dr. Pari mentioned. I have been in this field for the last 6 to 7 years. I mean, more than that, but into active training in the last 6 to 7 years, where I was interacting with the nurses. And I saw the challenges they face, and the immense strength and the resilience and dedication they have. In spite of the challenges, they work with so much of dedication, so much of resilience and strength. So I think it's very important. See, they don't work just as caregivers or healthcare providers. They are true guardians of life. They work for the patients. So, but do they have any recognition? They have little recognition. And do they have the support? Again, I don't think they have the support. So I believe that the nurses have to be empowered. Empowerment not just should be a goal. Empowerment just mean just having a goal to empower the nurses, but it is an absolute necessity. It's an absolute necessity to recognize them, to support them, to empower them, so that they can really contribute to the healthcare world. And empowering our nurses, it goes beyond handing them over the responsibility. Just not that, when I say empowering nurses, just giving them responsibilities to work in this healthcare setup, but it is to truly recognizing the worth and the potential they have, and recognizing the essential role they play in the healthcare of our nation. And normally we say that nurses are the backbone of healthcare, but I think they are the heart. If the heart stops, life stops. So also, if the nurses are not supported, if they're not given the recognition, our healthcare will suffer. And also, they are the strength and the vitality of healthcare. So that's very, very important to support them and recognize them. So I very strongly feel about this. We have to support them, and if we don't support them, our entire system will suffer. But if we support them and recognize them for the worth and the value, our healthcare system is going to be transformed. We can see the transformation in a healthcare setup if we recognize them and support the nurses. So this is what I think is going to be our vision. I'm very happy that I was given this opportunity to share my vision with all of you today. I'm very grateful for that. So let me now share the vision. I have to get that moving. Yeah. So let us look at the vision 2047 for nurses in India. So I mean, it may sound very, far-fetched, or, maybe a utopian task to achieve all this. But I think we should have a vision very high, sky high, so that we can reach somewhere and we can, try and achieve it. But as Dr. Pari said, as a collective, attempt by all of us, we should try and achieve this. I think the nurses should be respected as equals to doctors, and they should have a competitive pay which will, sort of value their service they provide. And they should take up leadership role, not just healthcare providers. And they should have a good work-life balance, and they should be provided with world-class education. So let me talk about each goal which I'm talking about, each vision. So as I said, we should envision that the nurses should be respected equally to doctors for the critical role and the vital role they play in the healthcare system, and the expertise they provide for the patient care. And competitive pay is very, very important. The nurses should, should make sure that they receive a fair compensation for the vital role in the healthcare system. And if you give them higher remuneration, competitive pay, and if they have job satisfaction here, I'm sure our nurses will remain in India, remain with us, and not try and go abroad looking for greener pastures, for better opportunities, and better for job satisfaction or better pay. So they will definitely be with us if we recognize their worth and provide them with a competitive pay. Then leadership role, again, I think the nursing profession, they should not just be caregivers, but they should become key. They should play a key role in becoming healthcare policy makers. They should be driving reforms and innovations. So that should be the role of the nurses, not just caregivers. The next, I think, work-life balance should be so good for the nurses that nursing, the profession should be looked upon. Like everybody wants to become doctors, they want to become engineers because it looks very glamorous. But nobody wants to become nurses. When you talk about nursing profession, they think it's not very glamorous. But we have to make it look glamorous, and because they have very good work-life balance, and it should be made one of the sought-after professions. So that's what is one of my visions. And of course, world-class education is very important. We have to aspire to make our nursing education and specialized training in India world-class, the best in the world, so that it attracts students. Students from outside other parts of the world should come to India for training. Not we from India should not be going abroad for training. So that should be at the level of our education and training in India.
Okay, I think that's a great vision, and I really liked your take on telling that nurses are the heart rather than the backbone. I think that's a very, very fantastic way of looking at nurses. And as you say, if the nurses are not going to be there, and tomorrow the hospital will come to a standstill. So I think it's better to call them the heart of the hospital. And you have highlighted the vision, and I'm sure there are many other opinions about vision, but this is something which at Skillsformed we looked at a lot of other vision statements, and we thought we'll highlight these five today. And next, I want you to look at, what are the current challenges. Usually, when you want to make a change, it's always better to look at where we are now, and then, look at the future. So, can you sort of explain what are the current challenges nurses face day to day in the workplace today?
Yeah, I think that's very, very important. So, unless we know what is the challenges we face now, so we'll not be able to change it and achieve our vision. So, the current challenges we face are workforce shortage, the skills gap, and work environment problem. So, what is the work shortage problem? There's high demand of nurses in India and globally. So because there's demand abroad, people from here move over. So there is, people constantly keep moving, and there is increase in turnover. So that is one of the major challenges. Next is skills gap. Though the nurses get trained, there's a lot of skills gap in the best practices and evidence-based practice. So though they apply whatever they learn in the practice, there is a gap in the in applying the best practices in the healthcare setting. And another important thing is lack of specialized and advanced care. So we just had a meeting this morning with the hospital in Kerala for labor room nursing training. So they were saying that a few years ago they had very well experienced nurses who are experienced for 5, 6 years experience are so good at their work. But currently the problem is the challenge they are facing is they don't have nurses who are experienced, and it's all novice nurses who have to be trained on the job. So that is why they came to us for training. So that is another problem, and the skills gap is because of that. And the nurses are so averse to technology use. So now the advancing technology with the coming in of AI, I think we have to be integrated. Technology has to be integrated as a part of our practice. Only then we can bridge the skills gap. The next is that the work environment, long hours. Nurses, because of nursing shortage, they work for long hours. They have to extend their shifts from one shift to another. They keep on working, and they're highly stressed. And they're so engrossed in their work and their day-to-day, this rush and this long hours of work. They don't have time for, thinking about their professional development of career. They just stagnate in the hospitals, and there's no lack of, there is lack of professional growth and opportunities for them. So that is the current challenge. So what are we doing now? Currently, we are just fighting the waves. We are just focusing on addressing the current challenge. We have to do that. We have to see these are the problems, these are the gaps. We have to try and fill the gaps and do the needful. But what is more important is look forward, look at the future, and make the nurses future ready. So for that, what do we have to do? We have to have a plan, and we have to envision our goals. Again, here it is not only us, it is all the nursing leaders, all the leaders of our nation should work towards this, have a plan and goal to achieve our vision.
Yeah, again, thank you so much. I think there was one important point there about the work environment I would like to highlight. So, this we get used to it. I think we get desensitized. So as we are working in the hospital day in and day out, and so the nurses also get, the leaders also get desensitized. And my daughter, who is a PhD student, she was actually visiting one of the well-known tertiary hospital in Chennai, and she came so upset, asking why is are the nurses being treated like this, and why are they having such stressful environment. And she actually wrote a LinkedIn post about it. No, I was not aware of it. And I read the post, and that is when I felt, my God, we have just got desensitized to the whole thing. We're not even thinking about it. So it's now people like a third person, I mean, who are totally new to the healthcare environment, are able to identify this. So I think it's very, very important point touched upon. So we're talking about visions and goals and all that, and nothing will work unless we have some strategic initiatives. Again, we may not be able to, position right now to start or implement any of the initiatives, but at least can you tell us what strategic initiatives might help us to move from where we are now to the goal we are envisioning?
Yeah, I think I'll do that. Yeah, it's very, very important. There could be, many strategies. I mean, actually, which we have to follow to reach our vision or goal. But then I think I will focus on four important things which I think will help us to achieve our vision. So one is educational reforms. The other is training opportunities for the nurses, and technology integration and professional development. So I just like to talk on each topic. Coming to educational reforms, it is a collective thing of the government, the Nursing Council of India, and the nursing college, which have to bring about these educational reforms. How can they do it? They have to update the nursing curriculum, and they have to make sure they promote evidence-based and best practices into the curriculum, so that when the nurses come out, they come out with they know what is best practice and how to, and they with a good skill. And also this leadership training. Leadership, if you look at it, it comes into the nurses think about it only when they become seniors. They join the thing, they keep working as staff nurses. Later down the line, a few years down the line, when they come to the senior level, then they think of becoming leaders. Even that, it only comes by seniority. I think leadership training should start in the nursing colleges. Nursing colleges should train them, tell them how to become leaders. That culture should be inculcated in the nursing colleges, so that when they come into practice, when they become nurses, they start thinking about it early. They're not just staff nurses or just not caregivers, that they also have to be leaders, and play a major role in policy making. All that, that knowledge should be given in nursing colleges. And of course, it's very important to include emerging technology into the educational reforms. The next is talking about training platform. Again, it is the healthcare organizations and training centers should provide healthcare platform for the nurses. So when it comes to the healthcare organization, they should implement regular in-service training programs. So every hospital says that they don't have time, they're so busy, they don't want to train the nurses. But it's very important the nurses are trained just to upskill them. They already they come with skills, just upskill them, update them so that they are up to date and they provide better and quality patient care. And also training centers, they should have on-site training and online training. On-site training through way of workshops, that will help to enhance this. So again, healthcare organization, as such, they may not be able to do it. They should get the help of the training centers to do this, to enhance the skill and knowledge of the staff. Then, of course, online training is very, very important, so that the nurses can update themselves, even when they're not at work, so they have through webinars and through courses. So online learning is also very, very important to update themselves and the knowledge and the skills. And coming to technology integration, is very, very important to collaborate with the technology companies, that they provide advanced tools like AI. Nowadays, AI is a in thing now. So that AI-driven tools are very, very useful. So they will help to the nurses to automate the routine nursing tasks, so that they can focus on direct patient care. So many other things you can do with AI tools. So this is one most important thing, is automating the routine tasks so that they'll be able to provide better direct patient care. Then collaborating with startups is very, very important, because they provide with the wearable health devices. They come up with a lot of innovations, like telehealth platforms and also mobile health apps. So these tools helps us in remote patient monitoring and improving patient care. Then we have this training through virtual reality and augmented reality. All this allows the nurses to practice complex procedures in a simulated environment, so that it will help them to enhance the skill and they develop confidence. Then you have the online platform through which, as I already mentioned, you can have webinars, online courses, so that you can keep the nurses updated. Then you have this our advanced electronic electronic health records, which is very, very useful. It helps in integrating all the data from various sources and help the nurses to improve the care coordination, enables them to make informed decisions, and in documentation is very, so this technology comes in use here as well. And also the telehealth platform, telemedicine is very important. It allows the nurses to provide care remotely in the areas which cannot access healthcare. They can do it from remotely by using telemedicine. Then coming to professional development, again, it's a collective thing of the government, public, and the private sector. So they should provide clear career paths. They should provide support for the nurses by way of scholarships, by way of giving grants, and so that the nurses can do research and see how they can develop in the career paths. And also the private and public sector should to provide opportunities for nurses. Nurses working in the hospital just get stuck as staff nurses or some particular grade. They should allow them to move laterally and give them managerial roles and advanced practices and make them leaders in their healthcare organizations. So it is very important to create pathways for the nurses to advance into leadership positions. So not just making them as just staff nurses and stagnate in wherever they are.
Yeah, I think you touched upon many strategies, and again, it was interesting to see you telling about technology, and I'm use technology quite a lot, and they're talking about physician AI assistant, where the AI will help the physician to sort of formulate diagnosis once you put in the data. So I don't know how many of us talk about AI nursing assistants. So that is what we need, and technology is a major thing which we need to do it as a strategy. And I just take us quickly through how do we get there? Now, what are the how do you think we can get there? Is there any other ways by which you think we can get there faster?
Yeah. That's very true. We cannot do it as a single person or only one particular area. It's not enough. You need collaboration and partnership in various. One is the government and professional bodies who have to develop policies that support nursing education and workforce development. Then we need to have collaboration. The global best practices, the global centers of excellence should collaborate with the Indian Center. The Indian Center should collaborate with the global centers of excellence and learn the global best practices for them and incorporate them into the training and practices standards in India. And the nursing colleges and the HCO should collaborate with the training centers. Again, here it is to update the best practice and skills. So that is very important. As here comes the concept of finishing school. Nursing finishing school, where after the nurses finish the school, 4 to 5 months, you give them intense training in the clinical practices, to introduce them into the quality. What is importance of quality patient care? Introduce communication skills there, and make them ready for working in a busy healthcare setup. So nowadays, what's happening is they just directly go from the nursing colleges. So they do have exposure to hospital setup, but then you give them advanced clinical skills training so that they are ready to go into the busy setup where there's so much of stress, they can start working with confidence and with expertise. Then we have, I think it's very important, there should be collaboration on nursing college industry partnership. Here, the nursing college should align with the industry needs, because the needs of the primary, secondary, and the tertiary care is very, very different. The primary, they just need basic preventive care, and the basic health needs has to be taken care of. And when it comes to secondary level, it's a little more advanced clinical training. When it comes to tertiary level, there's even advanced training and also research comes into play when it comes to tertiary care. So all this, so the nursing colleges and the training, they should align with these needs of the different industries. So that's very, very important. And concluding my talk, I would like to say, how is that we are going to achieve all this? So again, to nurture respect, so it has to be our culture. Culture change is very, very important. So if you see abroad, nurses and doctors are treated equally, but that doesn't happen in India. It's very, very, nurses are not treated equally. So it is a culture, just our culture, which has been there, from our college days. We've been ingrained in this culture. So that has to change to bring about this change, which I'm talking about. And then there has to be equality not only in the remuneration, in all aspects. It has to be advocacy by the healthcare organizations by making policy changes. There should be, and the nurses should be recognized for the value they're providing for healthcare healthcare system. And then they have to be given leadership opportunities. How can we do this? Again, collaborating with institutions like IAM, so they can provide leadership training for the nurses so that they can be, they can come play key roles as leaders. Then work-life balance, as I told you, is very, very important to make sure that the nursing profession is looked up upon. For that, one example I can tell is, basically you need to develop policies and promote work-life balance. How do you do that? One example is hospitals having creches for the, to take care of the children of the nurses. So when they come and leave the children in the creche, they'll be at peace and they can give the wholehearted work in the hospital for patient care. So that is one example of helping the nurses in having a work-life balance. And last but not the least is to promote educational excellence. This is again a collaborative effort of the government, the Nursing College of India and Nursing Council of India, the nursing colleges, healthcare organization, and the training center. It is a collective. Everybody has to put in the effort to bring about the change in the education for the nurses. So I'm so glad. I'm so thank you, Dr. Pari, for giving this opportunity to share my vision, to share our vision, Skillsformed vision with others here in this platform. And I'm glad for people who attended. I'm sure all of you will be a part of this journey in achieving our vision. So I wish we could have more. We will be having more sessions on this. This is a beginning. So we have to continuously be working at it. As Dr. Pari said, it's not a 3 or 5 year goal. It's going to be a 23 years goal down the line. So we have to work towards it. Thank you so much for this opportunity.
Thank you, Dr. Nitya. I think it's fantastic, very inspiring. So how do we bring about the change? You spoke about respected as equals, and of course, equal pay, or at least, see, the thing is, once the doctor finishes MBBS and say for an emergency physician wants to join as an emergency physician, they get about ₹1,00,000. And it is for this ₹1,00,000 that the nurses go to the GCC countries, right, or European countries. So that is where we are missing the boat. That's where really we're missing the boat, and I think we should address that. And of course, leadership role, work-life balance, and education is also important. So thank you so much. Thank you all so much for joining us. I think it's been so gratifying for us to share this. I think this is very thing we've been keeping to ourselves. I thought, let us share it, and we will spread the message. And I'm sure it will become a movement in a few years' time, and it will gather momentum. So that is our hope. So with that, let us end this webinar. Thank you so much, Dr. Nitya, for your views.
Thank you for giving me this opportunity and for expressing my views. It is really nice. And as Dr. Pari said, we will take it forward. We will not stop with this. Webinar ends here, but our journey starts now.
Thank you so much. Bye.